Let's get started. So I'm happy to introduce Bryce Morsky. He's an assistant professor at Florida State and works in math bio, and has a very neat, fascinating take on math bio, where I believe you do quite a bit of game theory. Is that fair to say?
Yeah. Usually there's game theory interspersed in a lot of stuff I do. Not actually so much this thing.
Oh, okay. All right. Well, nevertheless, yeah, Brian works on a variety of biological problems related to the cooperation of evolution of cooperation in human communities, cancer, infectious diseases, and other biological systems. So without further ado, please take it away.
Okay, great. Well, thank you for having me. Happy to present my work. So the title is NPIs, Vaccination and Collective Action Under Social Norms. This has been work with Errol Akshay and Troy Day and Felicia Magpanti. Errol's University of Pennsylvania and Troy and Felicia at Queen's University in Canada. I'll also include some newer work I've been doing as well. So let's kind of get to the first point, and I think a lot of talks I've been giving have, have featured this, that we have some sort of maybe economic system, biological system, but a huge part of what drives it is human behavior. Since we are such a hypersocial species, it's critical to add this into these models. And things like cultural, even like informal social institutions, like social norms, can determine who's going to get sick and who's not, and how disease is spread, who uses, it'll determine the uptake of vaccines and whether non-pharmaceutical interventions are used or not. So then the question was, okay, well, how do these things impact the spread of disease? And then what are the implications for public health policy? So one of the key informal institutions or rules that regulates human behavior are social norms. So this is kind of the main one I'll be talking about. And it's basically just the stuff everyone does. What you believe other people should do, what you believe you should do. Sometimes these are called prescriptive and descriptive norms. So descriptive is what you expect other people to do, and prescriptive is what you ought to do. They've been modeled in a variety of different ways as equilibrium of coordination games. I have my own work on this, inspired by work by Herb Gintis, that thinks of social norms as the device in a correlated equilibria. But the thing is, many norms are conditionally followed. So people only follow them if other people follow them. So a key social norm is this norm of sort of conformity or conditional cooperation. I'll engage in the behavior, I'll cooperate if everyone else does as well. So this is just some data of experiments that have been done with this. It's sort of interesting when you have a variety of different sort of behaviors. You have these conditional cooperators, and then you have those who free ride, who never cooperate. And then those who cooperate only up to a point. So the Schwacher paper, for example, they had individuals playing these games, and then they would know the past history. And so, well, if I thought the last person, cooperated last turn, okay, well, I'll cooperate this turn. So those are kind of the conditional cooperators. There are a lot of examples of the impact of norms. I mean, everyone will be familiar with this from the last few years with COVID. They can determine whether people were infected or not. There are also other cultural examples, like the burial practices in West Africa, and have had a significant effect on increasing the transmission of Ebola. They also impact the wearing of non-pharmaceutical interventions, so wearing masks or social distancing. And I'm sure everyone's very familiar with how political it gets too. So human behavior and social norms hugely drive the use of these sort of interventions. Okay, so in trying to model this, there are several factors, not just the biological factor. There's the social dynamics, individuals' awareness of and belief of how many people are sick, or how effective a vaccine is, or how effective masks are, how they assess risks. And then also heterogeneity, and not just heterogeneity in susceptibility or like just from different ages, but heterogeneity in behavior is sort of what I'm particularly interested in. Okay, so let's go to these a little bit more in detail. So there's a lot of game theory that does this. My PhD advisor, Chris Bow, does a lot of work on vaccination games, decision making. So that's kind of how I got my start on this. And you consider, individuals, I guess, are weighing the costs and benefits, and also have knowledge of other people's costs and benefits. This can lead to free riding, particularly with vaccines. I won't vaccinate because I believe everyone else will vaccinate. I'll still be protected from herd immunity. You have that incentive too. In fact, Chris's, when he was in a postdoc, he had showed that you couldn't reach herd immunity because of this free riding dilemma. Although it can be resolved once you consider a network, a contact network. Because in that case, locally for an individual, if they have sick neighbors, there's an incentive to vaccinate, even though globally, with a well-mixed population, there wouldn't be. Okay, also another important fact is awareness-driven behavior. So this paper by Joshua Weitz looked at short-term awareness. Individuals were responding to the death rate. As death rate increases, then they social distance more. I think that also is pretty realistic. I don't know if that's everyone else's experience as well, but I was definitely following I don't know the death rates. I think the infection rates that I was following, but definitely was responding to that. There's other work that looked at people were selfish, forward-looking individuals, and they would calculate, sort of when's the optimal time to distance. I think those are important, but norms would also affect people's calculations. Okay, and so a bit more about beliefs and social norms. So they can definitely act as catalysts that they can sort of, to promote coordination of certain behaviors. Christina Bicchieri, University of Pennsylvania, has done a lot of work on this. She calls it the Grammar Society. Her books are really great. I definitely would recommend reading those. Okay, and then more about this heterogeneity. There's certainly been lots of work modeling of heterogeneity in populations, but heterogeneity in behavior, I think, is going to be particularly interesting, and I'll get to that, how that changes the outcome of our mean field model. And then group dynamics. So, as I mentioned before, as everyone's going to know, these behavioral interventions are, of course, driven hugely by political affiliation. And in particular here, mask wearing, this Bockhemper paper shows that mask wearing can be driven not only by belief in its effectiveness, but also in the prevalence of mask wearing amongst others. So there's this homophily kind of effect, birds of a feather flock together. Other people wearing masks, I wear masks too. Early in the pandemic, we had, when I was a postdoc at the time, and there were two different bio buildings. And one, for some reason, everyone was wearing a mask, and the other one, no one was wearing a mask. And I definitely certainly felt the pressure when I was, walk from one to the other, because if I'm the only one wearing a mask, I kind of really felt like I stood out. In the other case, if I didn't have it on, I'd also stick out. Okay, so those social pressures are real. Okay, so back to the modeling, we're going to try to put a bunch of these factors together into a model. Try to make a simple, like a parsimonious model, and see what comes from it. So the first model I'll talk about, and most of the talk will be about this, is this model of non-pharmaceutical interventions. So it's an SEIR model. I don't think I'll talk too much about resusceptibility, at least in the first half. The standard, standard dynamics. The only thing we're going to really change here is this, the transmission rate. So the transmission rate can be reduced by using an NPI. P here is the amount that someone uses in an NPI. So as P increases, transmission rate decreases. We looked at other functions for this, for beta, and qualitatively they were similar. Like we looked at it was like 1 over 1 plus eta p to some power delta. It gave the same qualitative result. This one is simple. So eta here is the how effective the NPI is. So I mean, if it's 1, then we can fully stop transmission. Okay, so using the NPI can reduce transmission. That's great. Now, when do people use it or not? So we assume that they're going to weigh the risks and costs of engaging in the transmission reducing behavior. And then they'll change their behavior to increase their utility. So a susceptible individual has a utility that's been composed of 2 pieces, a relational utility and a material utility. The material utility is, and maybe material is not quite the right word, it's just sort of like the standard utility you'd think of. So this is the risk of getting the disease, and then the cost of engaging the behavior, or even just perceived cost. So you have a perceived cost of wearing a mask. And so this is just the risk of getting infected, and then that cost, which we assume here is, in this case, is linear. C is the cost. So P is the degree to which I'm engaging in the behavior between 0 and 1. But there's also this relational utility. Okay, so relational utility is sort of the warm glow you get from doing social things with other people. It could also be feelings of guilt. In this case, it kind of is a guilt, a negative utility, a disutility. So you get this utility if you behave differently from other people in the population. So Q is the average behavior in the population. And theta is simply the weighting of it. So how much do you care about this social utility, how much do you care about conforming with the behavior of other people? So that's just your total utility is that. And then we have a dynamic for people's change in their behavior. So it's epsilon F, and what we use for F is this was standard in the social science literature. It's called the Granovetter-Schelling dynamic, or not sure if it. I've been calling it that because that's so these papers from Schelling and Granovetter in the 60s, 70s, and 80s looked at this they call it tipping point model for engagement in some kind of behavior, whether it's strikes or voting and things like that. Okay, so we did this best response function, which is the smooth best response function minus p, and then epsilon is sort of the speed at which you can change your behavior. I think for most of the simulations I'll show, results of the simulations I'll show, epsilon is 1. Like you can change per day, I guess. Okay, so that forms that model. A little bit more about these tipping point models. So they were used to look at innovation, residential segregation, where like ethnic restaurants were situated in a city, how riots can start. It's really sort of simple dynamic. If you're above a threshold, then everyone can engage in the behavior. If you're below it, no one engages in it. You can also think of it as maybe one person will riot if one person will just riot. Another person might riot as long as there's someone else is rioting, and someone else might riot if there's 2 people rioting, that kind of thing. But how many people in the population have those preferences? And so you get this sort of this S-shaped curve from that, and so this tipping point model. So I've actually done some work on this myself, looking at applying this tipping point model to the evolution of cooperative behavior. So individuals can sort of join a group and then engage in certain behavior in that group, and it's driven, what behavior they choose is driven by a tipping point. It was inspired by file sharing, actually. So there's a few examples. I don't think I have any more about it. There are a few examples. So in terms of file sharing, with Napster and Morpheus and all these sort of sites, these programs, why should anyone upload music if they're pirating it? And they should just download it. They should just free ride on the sharing of others. But there was actually a lot of cooperation on these networks. So there was a lot of uploading. And the argument for this is that there's actually a law article about this. And the author calls it, his name's Strahovitz, and it's called, calls it charismatic code. That it takes, it uses our innate social norms to, get us to cooperate. And there are a couple other examples, one with the taxes. This is, I think it's in Minnesota, that they believe that people cheat on their taxes more because they think that their neighbors are also cheating on their taxes. But their neighbors are actually more honest than they think they are. And if you can let people know that, you can actually get more honest, more ruminants of tax. The other example is binge drinking on college campuses. Students often think there's more binge drinking than there is. There's more desire for binge drinking than there is. And so then they binge drink more than they otherwise would, right? The people who are binge drinking are very conspicuous. And you can reduce binge drinking by sort of communicating to students that, there are other people too who also don't want to binge drink. So these tipping point models, you can maybe push this interior equilibrium and try to work as a catalyst to push them to one side or the other. Okay, so here's the basic model. We have these best response dynamics, and then we have this SCIR model. What comes of it? Well, the main thing is the behavioral model and the social utility works like a switch. So if you're starting very low here, so there's very few people who are infected and almost no one's adhering to the NPI. People get sick. There is the middle material threshold dashed line. That would be the point at which you should start masking or using the NPI if you didn't care about social utility. But because you do, it's delayed. So no one wants to be the first one to start wearing the mask or distancing because no one else is doing it yet. So there's this delay, and then you get everyone engaging in it, and then everyone engages in it, and the disease gets controlled. You would move to the left. You're not at the top. You're moving to the left as the infections are reduced, and you should stop using the NPI when you get below the material threshold. But you don't, because now social pressure is to keep social distancing, keep using the mask. So then you get this delayed period. There's a delay in when you stop, and then you can go again and again as you get more waves of infection. So this creates an inefficient use of inefficient if you're not thinking about social utility. Inefficient adoption and halting of the use of the NPI. We describe this as a stickiness. The norm is there's this stickiness. Once you engage in a behavior, it's kind of hard to stop. Okay, so this can lead to waves. So here we have the results for different transmission rates. So these are the intrinsic transmission rate. And this would be reduced if you're using the NPI. Okay, so in the beta not equals 0.2, this is the standard outcome. So no one ever engages in the NPI. And then we increase the transmission rate, we can get this wave. So the blue here is susceptibles, the red is infected, and the yellow is the engaging in the NPI. So we get this wave of people, sort of a panic. Everyone starts wearing masks. This slows down the transmission a bit, and then they stop. And then you get this exit wave, an exit wave of infecteds. You can see it in the top right panel. But it doesn't get quite high enough to induce another period of mask wearing. But in the bottom left, it does. So you get the second wave. Although increasing beta further, you only get one larger wave. So what does this do? Well, it results in a non-monotonic response to changing parameters. You'd think as the transmission rate gets higher, more people will get sick. But that's not necessarily true. you get these drops in it because of when you get new, the size of the exit wave. I mean, so the worst case scenario would be the exit wave of infected is just below the threshold to induce NPI usage. So then you get this large exit wave. So, a lot of people get sick, but no one wears masks at all. So there's no tamping down of it. We also find this in terms of the NPI effectiveness. So for very low, when ADA, this is how effective the NPI is. When it's very low, then okay, no one's using it. All right, a lot of people get sick. As we increase it, it starts decreasing the number of people get sick. Then it turns around and you get this, excuse me, sawtooth-like pattern. So the final attack rate can actually increase with increased mass effectivity. And this is all due to this sort of exit wave, phenomenon. You can see, for these different panels here that, so you have C there, you have this one big response, and then in D, you get this large exit wave. And then at E, you would get two waves, right? At E, you get two waves, right? And then at F, at the dip right after that tooth, you get three. There's a big caveat here. These results assume no other interventions. So other vaccines or therapeutics, or even encouraging people to, wear masks again. I'm not saying, that, by a less effective mask, like poking holes in masks, or I'm not trying to say anything like that. There's just the behavior causes this. So a better mask is still, of course, going to reduce the chance of getting sick, but it just won't be used effectively, I guess, is maybe way I would say. Also, here we're just looking at the total number of people who get sick. If you're interested in the peak of the infection, the peak of the infection always does decrease as you increase the effectiveness of the NPI. So if you cared only about the peak, then yes, you want the most effective NPI. Okay, this other figure shows how this, check my time, how this, what's the effect of different R naughts. So we tried different R naught, and then we found what's the best NPI efficacy given that R naught. And unfortunately, can be very sensitive to what R naught you have, as you can see here. If you have, you're not going to be able to measure R naught that tightly. So if you had it anywhere from like 2.7 to 3, that's a pretty wide difference in what you'd recommend as the best NPI efficacy. I've been talking about it as masks or social distancing. You can, it could be a stand-in for some specific policy. Okay, so we've also find this, again, this non-monotonicity with varying other parameters. So this is the relational cost, how much you care about the social utility. We also find this kind of sawtooth pattern. Maybe point out F. So that's the point at which once you wear a mask, no one stops wearing masks. Social pressure is enough just to keep mask wearing as the standard. So any other increasing the relational cost any further after F is only going to harm people, because it just delays when people actually engage in using the mask. And at some point, social pressure is so much that they would never engage in the mask. Although if they did, they would never stop. And yeah, we can see again, this induces different number of behavioral waves. Okay, the material cost is slightly non-monotonic here. You can see D is a bit dipped. This is probably just because of the exposed component and so the nonlinearity, but it doesn't. I don't think this is as surprising. Generally, the higher the cost, you have fewer infections, fewer infection waves. Okay. So what about some other results and extensions to this model? You can imagine people have incorrect beliefs. There's waning resistance, asymptomatic transmission, higher order reaction kinetics. I didn't get into that here, but you can, if you have super spreader events and things like that. What kind of interventions would be recommended? I think basically from this, you would suggest, okay, well, when let's go back here, when these behavioral waves wane, then you should really encourage more mask use. Okay, so those are several other extensions. I want to talk about this one in particular, is looking at networks. I think this is quite interesting. So this is all in the supplementary information of the paper. You imagine individuals instead, they don't know the global behavior, they only know sort of a local behavior. So they can look at their neighbors to see their behavior, and we'll imitate that. So the infection spreads along that network, but also that network determines whether or not you use the NPI. So the conformity, you want to conform to your neighbors. So you have first order connections, second order, third order, et cetera. And so, yeah, like I said, you're only aware of the infection status, behavior of, say, masking of your immediate connections. What does this do? Well, now it is monotonic. So you can see that the attack rate just decreases as the NPI gets more effective. So being very locally aware decouples the network neighborhoods, and so we don't get the sticky, these waves from the stickiness of the norm. But as soon as you look at even second degree connections, it comes back. And then, of course, if you look at globally, or third and fourth and global information, then it comes back again too. There's this, I think it's really a problem of synchronization. So everyone sort of synchronizes on the behavior, and the local information kind of smooths things out a bit better. Some other extensions we looked at, what if you have different groups with different material costs? For me, it was very easy to social distance at the start of the pandemic. I could work remotely, so that was fine. But the results here are kind of qualitatively the same. We also looked like different relational costs. Those were also kind of qualitatively the same. We looked at biases in perception. So maybe you think there's more sick people than there is, or fewer sick people than there is. And again, kind of qualitatively similar. But one other thing we looked at, or I've been looking at, is the role of vaccination. Okay, so this is sort of the tail end of the talk here. So let's look at this is an SIR model with vaccination. So the class P here is sort of those who are protected. So it encapsulates those who have natural immunity and immunity from the vaccine. V is, or epsilon V is the rate at which you vaccinate. V is the rate of sort of your desire to vaccinate. So epsilon is sort of how quickly you can schedule an appointment. And we also use a best response function here for determining whether you're going, and like this Granover Schelling dynamic to determine whether you're going to engage in the whether you're going to become vaccinated or not. And a very similar utility, that you're going to use this conformity norm to determine whether or not you're going to vaccinate. Okay, so what does this model? What does this do? Well, actually, the results are kind of similar. Of course, here you get the infection is endemic. You get these waves of susceptible individuals. waves of infections, and waves of vaccine uptake. So people, use the vaccine and then they're protected for a while. It wanes, more infections, then that instead spurs vaccine uptake. The vaccine uptake is delayed because of this social stickiness. People are not, are sort of waiting until other people get vaccinated, and then that delay, unfortunately, results in more infections. There's also a nonlinear response to varying the parameter values here, in particular beta. So this is the, in the y-axis here, this is the infection load. So over, I think 400, averaged over for the 400 days, how many people get sick. So we actually have a peak for intermediate degree of transmission. And you notice the social utility, or the relational cost theta, actually has a kind of similar shape to the previous model, the NPI model. And then on top of that, I was looking at the role of information. So if you can just look at your neighbors or look globally, how does that affect things? So in this extension, individuals can only get sick from their neighbors, but then they're going to imitate the vaccination behavior of either their neighbors or everyone. I also looked at where they would look at their second order neighbors, and it's sort of in between these two cases. So the delta here is the mean degree of the contact network. So we can see that being local can really reduce the number of infections, right? So if I'm only going to observe people locally, that really can reduce it. And that's actually more important than if I even have a large contact network, right? So delta is 100, I have many more individuals I can get sick from. But it's key that I imitate the behavior of people just close to me, the people who can infect me, or who I can infect. When it's global, when I'm observing everyone and imitating everyone's vaccination behavior, we get much larger waves, and not only infections, but also in adoption of behavior. One other thing I want to say is that I don't have it here, but I also looked at sort of the optimal policy to promote vaccine use, and it sort of is what you'd expect. As the immunity wanes, we should encourage people to vaccinate, just sort of to push the vaccination behavioral, this wave in green, bit to the left, to preempt the incoming wave of infections. Okay, so in summary, social dynamics can drive oscillations and are hugely important in terms of the spread of disease. The stickiness derived from a social norm of conformity is a major player in this. And we can have this monotonic impact of different parameter values because of it. And I think the results are kind of counterintuitive at times. So what we conclude from this, I think institution responses need to be aware of the potential unintended consequences and the role of human behavior in uptake of vaccines and use of NPIs. I just finished with this quote from Francis Collins. You wouldn't have imagined, I think, early on that it would be such an issue of getting people to vaccinate or use NPIs and the like. But the role of information, misinformation, and sort of is transmission, is a huge part of whether whether these interventions are even used. All right. Well, I think I want to stop there, and happy to take any questions.
All right. Thank you. Do you have any questions from the audience?
I can jump in with a question. So All right, so you talked about how with the beta transmission rate that was something that you changed a little bit to see different forms of that, but you were getting basically the same results. And I guess my question would be then for the NPI, for setting up those equations, did you look at, a bunch of different variations of that as well, or did you kind of just pick your one model and go from there?
What part do you mean? Like the
So
I
for
said,
for the P differential equation, so the differential equation.
oh yeah, yeah. Oh yes, actually I did. I removed that from this talk because I thought it was maybe excessive. Yes, we did. Now I haven't at some point I kind of abandoned that model and moved entirely on this one, but I did I use a replicator type of dynamic actually. And for adoption of the behaviors. So you'll have, so it would be
So
P1
Tracy,
minus P and then like the utility for engaging in it and then minus the utility for not engaging in it. And I got similar results, but I didn't fully investigate that because at a certain point I entirely switched using this best response dynamic.
so
Circuit.
this function, I'm trying to say that this function looks very much like it came as a solution of some sort of logistic equation, right?
Mm-hmm.
Yeah.
Yeah,
And
yeah. I mean, it's just all it's meant to do is, and so kappa here is to represent your sensitivity to the
correct, yes.
payoff difference. Yeah.
And U and the difference of U's is basically the difference between the zero and the carrying capacity of sorts.
Well, the difference between engaging in the NPI and then not engaging in NPI.
Right.
So
Okay.
Thanks.
But yeah, you can do it would be
Basically it's similar to like the rumor spreading, right? So initially it's slow and then it picks up and then it slows down near the saturation. So that's the kind of function that you have.
yeah.
Okay, thank you.
Great. Any others?
Since I started talking, hi, very nice talk, Bryce. I'm Sergey. I have a question based on sort of trying to model heterogeneity in the population. One way to do this is like you introduce the network.
Mm-hmm.
And so you have people and their immediate neighbors and they're twice remote and so on. So, but you could also consider there is this Lagrangian approach, right, to modeling heterogeneous populations, basically by considering a fraction of time that you spend in different parts of the environment. And so remember you mentioned at the beginning, like you worked and you constantly had to go back and forth between two buildings. And if in one building nobody wears a mask and in the other everybody wears a mask, then you just weigh in the fraction of time that you spend in each environment, and then that dominates what you do.
Okay, yeah.
And then so in a more if you extend that idea, then you could consider a fact that going from home to work, you will be on, I don't know, public transport or whatnot, and people exhibit one sort of behavior, and then at work they exhibit another, and so on. And so you would be basically averaging you're deciding based on the average of what you see during the day, right? Have anybody done that? Has anybody
No,
done that?
no, not that I know of. That sounds like that sounds like a good idea.
It's very similar to what you do, except you try to average over different subpopulations based on the fraction of time that you're observing that particular subpopulation.
Yeah, this can be very useful. I another project I'm working on is the role of is coupling these kind of models to unemployment. And so then I have individuals who are employed and unemployed. And applying what you're saying to that would be in particularly useful. So I don't know of anyone who's done that.
But us being in America and American being a divided society, what's also important is to realize that this division in the society may also cause some of this may affect the basically your decision to do things. One, you try to follow people that you like, but also you try not to follow people that you dislike, and so you are again weighing the two options.
Yeah, there's some work on this. Paul Smaldino has a paper where they have this homophily of so that determines whether people, if I interact with people who are like me, then I can engage in careful versus uncareful behavior. They also have this outgroup antagonism where I just sort of choose the opposite of the people who are not of my type. And in their model, what that results in is essentially you can get, I think it takes a longer time for people to engage in the protective behavior, and it's not as high of a degree. But also, if the outgroup antagonism gets very high, then it ends up being the population switch. So one becomes careful, very careful, and the other one's very uncareful.
Does it lead to bistable situations where you can get stuck in one scenario versus another, depending on where you were at the beginning?
Yeah, exactly. So you'd have one population will be the careful one, another one will be the uncareful one, and it could be the other way around, depending on what the initial conditions were.
Very nice, very nice. Thank you.
All right, well, we'll conclude here. Thank you again, Bryce. Thank you so much.
All right, yeah, thank you so much.
Appreciate it.